they do on the airlines. We'll do a destination check. We are here to participate in a workshop on the implications of the California wildfires and their population and environmental health consequences for communities and for preparedness. If that is not your planned destination, now would be a good time to deplane. So I'm Dr. Ken Kizer. I've had the pleasure of working with the Academy staff and a wonderful planning committee to put together this two-day workshop. I'm going to take a few minutes this morning to talk a little bit about what we hope to do over the next 2 days, and also welcome a couple of folks to the podium who will extend some formal welcome to you as well. I should note at the outset that in addition to all of you all who are here in person, this is also being webcast nationally, and we have a much larger audience, and as things progress, we will be taking questions both from you here in the audience as well as folks who are joining us virtually. And in that regard, I should also note that the proceedings are being recorded, and there will be a record in a couple of different forms. The entire webcast will be maintained in perpetuity, whatever that means, on the National Academy's website. And we will also, some weeks after this is completed, we'll produce a proceedings. The recording, some of which will appear in the webcast that will be kept for the duration, and other parts will be used to maintain or to prepare the proceedings. So at the moment, I don't have a screen to look at, so I will have to periodically turn around to make sure that I'm on the right slide. But as I said, we're here for this workshop. My role is to give some opening comments and to thank some folks and to acknowledge those who have helped us put this together. And after Dr. Lebarski's and Dr. Ward to give a quick overview of what we hope to cover over the course of today and tomorrow. I should acknowledge at the outset, and we'll probably make this point repeatedly, that one of the biggest challenges the planning committee faced in putting this together was the amount of material that could be presented. There is far more than could be comprehensively even touched on in 2 days. A primary focus of this meeting is to talk about vulnerable populations. So we have, at the expense of some other topics, included sessions on some of what we thought were vulnerable populations and populations that often don't get as much attention as perhaps they should. But in doing that and recognizing the constraints of time, we also had to shorten and abbreviate some other sessions that we might have wanted to spend more time on, and certainly are meritorious and worthy of spending time on, but just the time does not allow that. So this is a bit of an unusual event for the National Academies of Sciences, Engineering, and Medicine, in that let me go back. It's hosted by 4 different entities within the academies and is generated and really is a product of the academies. As you probably know, most of the work that the National Academies do is at the request of other government agencies or philanthropies or others, and is funded by those entities, often at the request, put request in quotes, of the Congress. But in this case, we felt that the topic was so important and had so many implications that the Academy decided to host it basically itself. So it is a a product of the of 4 different entities within the National Academies, as are listed on the slide. And there are, I think, 11 different such entities within the academies now. So this represents actually a significant number of those. The other way that this is unique is that it is being hosted at a site other than one of the National Academy's facilities. Normally, workshops and consensus committee meetings and other such events are hosted either in Washington, D.C. at one of the 2 main sites there for the National Academies, or up at Woods Hole, or down at the Beckman Center in Southern California, where the National Academies has its own facilities at all of the sites. But in this case, they reached out, and I'm very pleased that they have decided to work with the University of California, Davis in hosting this, and I certainly want to acknowledge now, and will do so at other occasions, the University of California, Davis for hosting this, and the incredible generosity that they have demonstrated in making facilities and other support available for these 2 days. Any event such as this requires the work of a bunch of folks, and that is the case here. Over the past 2 or 3 months, we have met on a essentially weekly basis to flesh out the program, identify speakers, topics, and as I already noted, one of the problems that we rapidly encountered was the large amount of information and the constraints of time, and had to make some choices. I would like to acknowledge the Planning Committee members, and indeed I would ask that they stand. I think most, if not all of them, are here. I'm here, I think. Sometimes I'm not entirely sure. Julie Baldwin, Julie, and Michelle Bell. Hi, Michelle. Wayne Cassio, David Eisman, Dick Jackson. I don't know if I saw Dick. Okay. Wayne Jonas, later as well, okay. Suzette McKinney and Winston Wong, and a special recognition to Winston. The original genesis of the idea for having this came from Winston, who leaned over my shoulder at one of the meetings of the Board on Population Health at the academies and said, I have this idea. Why don't we hold this workshop on the California wildfires and what that means? And then that kind of got out of control and resulted in where we are today. So special thanks and kudos to Winston for being the genesis of this workshop. I would also be remiss if I didn't acknowledge that in addition to the National Academies, which have put the support of the organization behind it, we also have had some extra help and support from the California Endowment and the Moore Foundation, the California Wellness Foundation, and the EPA, excuse me, as well as the many sponsors of the individual boards and the forum that are sponsoring this. So with those comments, I would like to actually invite to the podium and turn it over for some comments from David Lebarsky, who is the Vice Chancellor for Human Health Sciences here at the University of California, Davis, and the Chief Executive Officer of UC Davis Health. So, David.